putting an implant and doing a breast reduction is too risky a procedure. Having said that, putting an implant and doing a lift is okay, because in the lift, we're just removing skin. We're not removing breast tissue. When we put an implant in, we're making several incisions. So there's the incision at the bottom of the breast crease. Whenever we make an incision, it automatically cuts blood vessels. So there's no way to cut through skin or tissue without cutting blood vessels. Then when you cut the muscle, you're cutting more blood vessels. Then when you're lifting the muscle, you're detaching more blood vessels. So the blood vessels in the breast are compromised temporarily during the breast augmentation process, but it's very safe because our body has this redundancy and this ability to shunt blood and move it around and change the circulation and heal itself. It's one of the amazing things about surgery. So our body can overcome a breast augmentation. Eventually, your body forms new blood vessels and you're fine. Breast reduction, you're cutting tissues in a totally different area. You're cutting tissue around the areola. You're cutting tissue in the middle of the breast. You're removing tissue from the sides. That cuts a ton of blood vessels. Again, when you do a breast reduction by itself, that's fine because the body can tolerate that. And then once you're healing, it makes new blood vessels and it'll heal itself. But if you combine the two, the stress that's going to put on your tissues, the amount of blood vessels that it's going to cut is too much. And there's a very high risk that you will not be able to bring blood and oxygen and nutrients to your tissues, and you're not going to heal. And when that happens, skin opens, it gets infected, and you have complications. So again, the body has the redundancy and the backup of other blood vessels to heal itself. But it's not safe to combine a breast reduction with an implant.